NHA Medical Assistant Last Minute Review. Question 1. When an injection is complete, why should the assistant discard the syringe and needle as one unit? Option A. Places the bevel just beneath the epidermis. Option B. Limits manipulation of contaminated sharps. Option C. Uses a well-developed thigh muscle away from major nerves and vessels. Option D. Controls bleeding without increasing tissue irritation. The correct answer is option B. Limits manipulation of contaminated sharps. Discarding the syringe and needle as one unit limits manipulation of contaminated sharps. Inserting an intradermal needle at a shallow 5- to 15- angle places the bevel just beneath the epidermis. Using the vastus lateralis for an infant intramuscular injection uses a well-developed thigh muscle away from major nerves and vessels, and applying gentle pressure rather than vigorous rubbing controls bleeding without increasing tissue irritation. Question 2. During basic pharmacology review, the assistant encounters ACE inhibitor. What does this term mean? Option A. A controlled analgesic class that can cause respiratory depression. Option B. A medication used to relieve pain. Option C. A medication that reduces angiotensin II formation. Option D. A medication used to decrease diarrhea. The correct answer is option C. A medication that reduces angiotensin II formation. ACE inhibitor is a medication that reduces angiotensin II formation. It lowers blood pressure and can cause cough, hyperkalemia, or angioedema. Opioid is a controlled analgesic class that can cause respiratory depression, while analgesic is a medication used to relieve pain and antidiarrheal is a medication used to decrease diarrhea. Question 3. Which outcome supports indexing scanned documents to the correct patient and category when an outside report is uploaded? Option A. Keeps imported information searchable and linked to the proper chart. Option B. Preserves accountability and protects access to electronic protected information. Option C. Reduces risk of credential theft and malware. Option D. Supports restoration while keeping protected information secure. The correct answer is option A. Keeps imported information searchable and linked to the proper chart. Indexing scanned documents to the correct patient and category keeps imported information searchable and linked to the proper chart. Using an individual login rather than sharing credentials preserves accountability and protects access to electronic protected information. Reporting suspected phishing messages reduces risk of credential theft and malware, and protecting backup media and recovery systems supports restoration while keeping protected information secure. Stressed about your NHA Medical Assistant Exam? We can take NHA Medical Assistant Exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. How should expressed consent be understood when studying medical law and ethics? Option A. A legal command to appear, testify, or produce records. Option B. The ethical duty to promote the patient's welfare. Option C. Unlawful restraint of a person's freedom of movement. Option D. Permission communicated verbally or in writing. The correct answer is option D. Permission communicated verbally or in writing. Expressed consent refers to permission communicated verbally or in writing and clearly states the patient's agreement to the proposed care. Subpoena refers to a legal command to appear, testify, or produce records. Beneficence refers to the ethical duty to promote the patient's welfare, and false imprisonment refers to unlawful restraint of a person's freedom of movement. Question 5. How does using a pain scale appropriate to the patient's communication ability help when a young child cannot reliably use a standard numeric pain rating? Option A. Preserves accuracy when documenting temperature in a different scale. Option B. Prioritizes urgent assessment of impaired oxygenation. Option C. Improves accuracy by standardizing posture and removing added footwear height. Option D. Improves the validity of pain assessment by matching the tool to developmental level. The correct answer is option D. Improves the validity of pain assessment by matching the tool to developmental level. Use a pain scale appropriate to the patient's communication ability. This matches the pain tool to the patient's communication ability. Converting Celsius to Fahrenheit using the prescribed formula preserves accuracy when documenting temperature in a different scale. Reporting a low oxygen saturation with respiratory distress immediately prioritizes urgent assessment of impaired oxygenation, and measuring height without shoes and with the patient upright improves accuracy by standardizing posture and removing added footwear height. Question 6. Which safety or quality benefit comes from using a closed-ended question to clarify a specific detail when the onset date of a symptom is still unknown? Option A. Reveals misunderstandings and supports safe follow-through. Option B. Obtains focused factual information efficiently. Option C. Records facts, education, response, and notifications without judgment. Option D. Supports orientation, independence, and safety. The correct answer is option B. Obtains focused factual information efficiently. Using a closed-ended question to clarify a specific detail obtains focused factual information efficiently. Confirming understanding by asking the patient to explain the plan reveals misunderstandings and supports safe follow-through, while documenting clinically relevant communication objectively records facts, education, response, and notifications without judgment. Describing the environment to a patient with visual impairment supports orientation, independence, and safety. Question 7. The assistant plans to use the chain of command for an unsafe instruction after noting that a requested task conflicts with policy and training. Which reason supports this step? Option A. Performs venipuncture with incompetence and applicable law. Option B. Seeks clarification and prevents harm without silently proceeding. Option C. Carries out a technical procedure without independently interpreting it. Option D. Escalates information rather than making a diagnosis. The correct answer is option B. Seeks clarification and prevents harm without silently proceeding. Use the chain of command for an unsafe instruction. This seeks clarification and prevents harm without silently proceeding. Collecting blood specimens when trained and authorized performs venipuncture with incompetence and applicable law. Performing an EKG after an authorized order carries out a technical procedure without independently interpreting it, and reporting abnormal findings promptly escalates information rather than making a diagnosis. Question 8. After recognizing that a patient reports crushing substernal discomfort, why should the assistant treat chest pressure with diaphoresis as an emergency? Option A. Clears hazards and supports safety without restraining movements. Option B. Combines emergency activation, compressions, and airway assessment. Option C. Supports rapid evaluation for acute coronary syndrome. Option D. Prevents aspiration and permits treatment by trained emergency personnel. The correct answer is option C. Supports rapid evaluation for acute coronary syndrome. Treating chest pressure with diaphoresis as an emergency supports rapid evaluation for acute coronary syndrome. Protecting a patient from injury during a seizure clears hazards and supports safety without restraining movements, while beginning CPR if a choking patient becomes unresponsive combines emergency activation, compressions, and airway assessment. Activating emergency care for an unresponsive hypoglycemic patient prevents aspiration and permits treatment by trained emergency personnel. Are you looking for NHA Medical Assistant Exam actual questions? Visit our website pokerexams.com to access NHA Medical Assistant Exam Study Guide with actual questions and answers. Scan the QR code or click the link in the description to get NHA Medical Assistant Exam answer key today. Question 9. In this situation, a patient reports being allergic to an antibiotic. Why is recording allergies and the specific reaction appropriate? Option A. Checks understanding and gives the patient an opportunity to correct errors. Option B. Identifies changes that can affect risk assessment and clinical decisions. Option C. Distinguishes a true allergic response from an intolerance or side effect. Option D. Preserves the meaning of the statement for prompt clinical assessment. The correct answer is option C. Distinguishes a true allergic response from an intolerance or side effect. Record allergies in the specific reaction because it distinguishes a true allergic response from an intolerance or side effect. Summarizing key information back to the patient checks understanding and gives the patient an opportunity to correct errors, while updating medical, surgical, family, and social history identifies changes that can affect risk assessment and clinical decisions. Documenting the patient's exact words for a sensitive statement preserves the meaning of the statement for prompt clinical assessment. Question 10. Which result is expected from confirming scheduling details at the end of the call when an appointment has been arranged? Option A. Gets the issue to someone able to decide. Option B. Reduces errors involving date, time, location, and preparation. Option C. Maintains trust and focuses attention on correction. Option D. Provides consistent information without arguing. The correct answer is option B. Reduces errors involving date, time, location, and preparation. Confirming scheduling details at the end of the call reduces errors involving date, time, location, and preparation. Escalating unresolved complaints through the chain of command gets the issue to someone able to decide, while not blaming coworkers or the patient maintains trust and focuses attention on correction. Explaining office policy clearly and respectfully provides consistent information without arguing. Question 11. When a pathology report is added to the electronic record, why should the assistant index scanned documents to the correct chart section? Option A. Ensures consents, history, and financial documents are complete. Option B. Prevents time-sensitive concerns from being handled as routine paperwork. Option C. Supports timely review and correct filing. Option D. Makes information retrievable and prevents misclassification. The correct answer is option D. Makes information retrievable and prevents misclassification. Index scanned documents to the correct chart section because it makes information retrievable and prevents misclassification. Collecting required forms before rooming the patient ensures consents, history, and financial documents are complete. Routing incoming clinical messages prevents time-sensitive concerns from being handled as routine paperwork, and date-stamping supports timely review and correct filing. Question 12. Why is recognizing the audit trail as a record of system activity appropriate when management investigates possible unauthorized access? Option A. Prevents documentation in the wrong record. Option B. Shows who viewed or changed information and when. Option C. Follows role-based access and privacy requirements. Option D. Maintains record integrity and documents the correction. The correct answer is option B. Shows who viewed or changed information and when. Recognize the audit trail as a record of system activity because it shows who viewed or changed information and when. Verifying the correct patient before entering data prevents documentation in the wrong record. Accessing only records needed for assigned duties follows role-based access and privacy requirements, and amending an error maintains record integrity and documents the correction. Question 13. Which outcome supports reporting an occupational exposure immediately when the assistant sustains a needle stick from a used device? Option A. Allows prompt wound care, documentation, risk assessment, and post-exposure management. Option B. Physically removes organic material that alcohol-based hand rub may not adequately clean. Option C. Assumes blood and body fluids may be infectious regardless of known status. Option D. Reduces exposure to particles that remain suspended in air. The correct answer is option A. Allows prompt wound care, documentation, risk assessment, and post-exposure management. Reporting an occupational exposure immediately allows prompt wound care, documentation, risk assessment, and post-exposure management. Washing with soap and water when hands are visibly soiled removes material that hand rub may miss. Using standard precautions for every patient treats blood and body fluids as potentially infectious, and placing a patient with suspected airborne infection in appropriate isolation reduces exposure to particles that remain suspended in air. Question 14. What is the main reason to offer reasonable disability accommodations when a patient identifies a communication or mobility need? Option A. Supports rescheduling or other approved solutions without false promises. Option B. Helps de-escalate emotion and keeps the interaction professional. Option C. Supports equitable access to services. Option D. Turns feedback into a targeted process change. The correct answer is option C. Supports equitable access to services. Offering reasonable disability accommodations supports equitable access to services. Offering realistic options during a delay supports rescheduling or other approved solutions without false promises. Using a calm tone with an angry patient helps de-escalate emotion and keeps the interaction professional, and reviewing satisfaction trends for improvement turns feedback into a targeted process change. Question 15. How does selecting the median cubital vein when suitable help when several antecubital veins are visible and palpable? Option A. Preserves analyte stability and supports accurate results. Option B. Uses a well-anchored vein that is commonly easiest and safest to access. Option C. Recognizes its proximity to nerves and the brachial artery. Option D. Stabilizes the vein and reduces rolling during needle entry. The correct answer is option B. Uses a well-anchored vein that is commonly easiest and safest to access. Selecting the median cubital vein when suitable uses a stable vein that is usually easiest to access. Transporting specimens under required conditions preserves analyte stability and supports accurate results. Using extra caution before selecting the basilic vein recognizes its proximity to nerves and the brachial artery, and anchoring the vein below the intended puncture site stabilizes the vein and reduces rolling during needle entry. Question 16. Which safety or quality benefit comes from tracing each lead wire back to its labeled connector when the tracing suggests possible limb-lead reversal? Option A. Reduces electrical interference from active skeletal muscle. Option B. Records the left-arm electrical reference without reversing sides. Option C. Verifies that wires are attached to the intended electrodes. Option D. Records the right-arm electrical reference without reversing sides. The correct answer is option C. Verifies that wires are attached to the intended electrodes. Trace each lead wire back to its labeled connector. This verifies that wires are attached to the intended electrodes. Not placing electrodes over large muscle masses when alternatives exist reduces electrical interference from active skeletal muscle. Placing the left-arm electrode on the left upper limb area records the left-arm electrical reference without reversing sides, and placing the right-arm electrode on the right upper limb area records the right-arm electrical reference without reversing sides. Question 17. The assistant plans to limit tourniquet application to about 1 minute after noting that vein selection is taking longer than expected. Which reason supports this step? Option A. Reduces hemoconcentration and altered analyte results. Option B. Prevents dilution or contamination of the specimen by infused fluid. Option C. Avoids the center pad, bone, and heavily calloused areas. Option D. Increases local blood flow and improves specimen collection. The correct answer is option A. Reduces hemoconcentration and altered analyte results. Limit tourniquet application to about 1 minute because it reduces hemoconcentration and altered analyte results. Not collecting above an active intravenous infusion prevents dilution or contamination of the specimen by infused fluid, while using the lateral side of the middle or ring fingertip for an adult capillary puncture avoids the center pad, bone, and heavily calloused areas. Warming the capillary site when appropriate increases local blood flow and improves specimen collection. Question 18. After recognizing that a patient appears anxious while describing a stigmatized condition, why should the assistant maintain eye contact and a neutral tone? Option A. Supports therapeutic communication and reduces perceived judgment. Option B. Protects privacy and respects the patient's control over the interview. Option C. Preserves the meaning of the statement for prompt clinical assessment. Option D. Obtains specific information efficiently after the initial narrative. The correct answer is option A. Supports therapeutic communication and reduces perceived judgment. Maintain eye contact and a neutral tone. This supports therapeutic communication and reduces perceived judgment. Asking permission before discussing sensitive information with a companion present protects privacy and respects the patient's control over the interview, while documenting the patient's exact words for a sensitive statement preserves the meaning of the statement for prompt clinical assessment. Using focused closed-ended questions to clarify details obtains specific information efficiently after the initial narrative. Stressed about your NHA Medical Assistant Exam? We can take NHA Medical Assistant Exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. In this situation, the next visit requires a routine physical examination. Why is preparing the examination room before seating the patient appropriate? Option A ensures supplies, equipment, cleanliness, and safety are ready before care begins. Option B supports comfort, professionalism, and risk management. Option C provides access to the front of the body while supporting alignment. Option D confirms that the provider obtained authorization before the procedure. The correct answer is option A. Ensures supplies, equipment, cleanliness, and safety are ready before care begins. Prepare the examination room before seating the patient. This ensures supplies, equipment, cleanliness, and safety are ready before care begins. Offering a chaperone supports comfort, professionalism, and risk management, while using the supine position for a general anterior examination provides access to the front of the body while supporting alignment. Verifying informed consent is completed confirms that the provider obtained authorization before the procedure. Question 20. Which result is expected from not prescribing or selecting medication when a patient asks which antibiotic they should start? Option A preserves authorship and legal accountability. Option B reserves diagnostic conclusions for licensed providers. Option C avoids medical decision-making outside the assistance authority. Option D keeps medication activity within delegated authority. The correct answer is option C. Avoids medical decision-making outside the assistance authority. Do not prescribe or select medication. It avoids medical decision-making outside the assistance authority. Not signing the provider's name preserves authorship and legal accountability. Not independently diagnosing a patient reserves diagnostic conclusions for licensed providers, and administering medication only with a valid order and permitted supervision keeps medication activity within delegated authority. Question 21. When a procedure is underway and instruments are being passed, why should the assistant assist the provider while observing the patient? Option A supports efficient care and early recognition of distress. Option B supports comfort, professionalism, and risk management. Option C provides appropriate access with the hips and knees flexed. Option D preserves sterility and reduces contamination risk. The correct answer is option A. Supports efficient care and early recognition of distress. Assist the provider while observing the patient because it supports efficient care and early recognition of distress. Offering a chaperone supports comfort, professionalism, and risk management. Using the lithotomy position for a pelvic examination provides appropriate access with the hips and knees flexed. And preparing a sterile field without reaching across it preserves sterility and reduces contamination risk. Question 22. How should post-analytical error be understood when studying CLIA and laboratory quality? Option A. Evaluation that testing personnel can perform assigned procedures correctly. Option B. A limited microscopy category performed during a patient visit by an authorized provider. Option C. The laboratory category with the most demanding personnel and quality requirements. Option D. An error occurring after analysis. The correct answer is option D. An error occurring after analysis. Post-analytical error refers to an error occurring after analysis and includes transcription, reporting, communication, and follow-up failures. Competency assessment refers to evaluation that testing personnel can perform assigned procedures correctly. Provider-performed microscopy refers to a limited microscopy category performed during a patient visit by an authorized provider. And high-complexity test refers to the laboratory category with the most demanding personnel and quality requirements. Question 23. Which outcome supports allowing the patient to rest before repeating blood pressure when a patient hurried into the office and was measured immediately after climbing stairs? Option A. Prevents an inaccurately low or unreliable measurement from an oversized cuff. Option B. Prevents hydrostatic error that can falsely elevate the reading. Option C. Supports timely provider assessment for possible severe hypertension. Option D. Reduces temporary elevation caused by recent exertion. The correct answer is option D. reduces temporary elevation caused by recent exertion. Allowing the patient to rest before repeating blood pressure reduces temporary elevation caused by recent exertion. Using a smaller cuff designed for the patient's arm prevents an inaccurately low or unreliable measurement from an oversized cuff. Supporting the patient's arm at heart level prevents hydrostatic error that can falsely elevate the reading, and reporting a new markedly elevated blood pressure promptly supports timely provider assessment for possible severe hypertension. Question 24. What is the main reason to use the patient's stated name and pronouns when the record includes affirmed communication preferences? Option A. Communicates respect and improves information gathering. Option B. Validates feelings without making unrealistic promises. Option C. Records facts, education, response, and notifications without judgment. Option D. Demonstrates respect and reduces alienation. The correct answer is option D. Demonstrates respect and reduces alienation. Use the patient's stated name and pronouns because it demonstrates respect and reduces alienation. Listening without interrupting the initial explanation communicates respect and improves information gathering. Acknowledging emotion with an empathetic response validates feelings without making unrealistic promises. And documenting clinically relevant communication objectively records facts, education, response, and notifications without judgment. Question 25. How does moving electrical cords away from interference sources help when the tracing shows uniform thick or regular electrical interference? Option A. Reduces alternating minus current artifact from nearby equipment. Option B. Minimizes muscle activity and supports standardized lead placement. Option C. Creates a small contact area while limiting unnecessary skin irritation. Option D. Restores consistent electrical contact. The correct answer is option A. Reduces alternating minus current artifact from nearby equipment. Moving electrical cords away from interference sources reduces alternating minus current artifact from nearby equipment. Positioning the patient supine or minimizes muscle activity and supports standardized lead placement. Clipping excessive hair rather than shaving broadly creates a small contact area while limiting unnecessary skin irritation. And securing loose electrodes and lead wires restores consistent electrical contact.